Advances in technology such as mobile phones, airplanes, telephones, and the internet have made the growth of transport and communication networks possible. Among other things, this means that people and countries can exchange information and goods more quickly in a less complicated way. This process is called globalization. Globalization is a complex and multifaceted set of processes having diverse and widespread impacts on human societies worldwide. According to K. Lee, it can be defined as changing the nature of human interaction across a wide range of spheres, including economic, political, technological, and environmental. These varied forces impact directly and indirectly on health at a number of different levels. For example, globalization can alter the health status through changes in basic living conditions and household incomes. At different levels, therefore, global change can bring either health benefits or costs depending on who you are and where you live. Now, in what way can globalization be used as a means of spreading infectious diseases? The processes of globalization potentially influence a broad range of biological, environmental, and social factors that affect the burden of many important human infections. These consider the nature of infections and how, in simple terms, globalization may increase or decrease the distribution, spread, and impact of infectious diseases in a given population. An infection occurs when a microorganism survives and multiplies within another, usually a larger one. The infected organism is called the host. In infectious diseases, unwanted signs and symptoms usually result from damage to the tissues and organs of the host, and the microorganism is known as a pathogen. In the past, infectious diseases have been the most important contributor to human morbidity and mortality. According to the World Health Organization, the global burden of disease study estimates that in the year 2000, infectious diseases were responsible for 22% of all deaths and 27% of disability-adjusted life years worldwide. The term infectious disease does not refer to a homogeneous set of illnesses, but rather to a broad group of widely varying conditions. The relative and absolute importance of particular infections or groups of infections varies dramatically across regions. As I've mentioned earlier, globalization is defined as changing the nature of human interaction across a wide range of spheres. Economic globalization describes the restructuring of the world economy from one centered on production and exchange relations between economic entities located in different countries towards a highly complex kaleidoscope structure involving the fragmentation of many production processes and their geographical relocation on a global scale in ways which slice through national boundaries. These fundamental changes to economies worldwide are believed to be having a range of impacts on infectious diseases. Globalization appears to be causing profound, sometimes unpredictable changes in the ecological, biological, and social conditions that shape the burden of infectious diseases in certain populations. Individuals and population groups show varying degrees of gains and losses from economic globalization and thus differential vulnerability to infectious diseases. Today, the world is now facing a global pandemic. The outbreak of the new coronavirus that began in Wuhan, China, affected factory closures and production suspensions, which are already disrupting global supply chains. So far at least, financial commentators have focused on cost calculations for particular sectors such as automakers worried about shortages of parts and the tourism sector where cruise ships in particular have become hotbeds of contagion. The impact of globalization and infectious diseases supports the need for appropriate forms of global governance on key issues to improve systems for prevention, control, and treatment. There is a need for enhanced training on the global dimensions of infectious diseases. It also supports the need for greater attention to be paid to the impacts on the infectious disease burden of policy decisions taken in other sectors such as trade and investment, large infrastructure projects, migration, agriculture, transportation, and communications. It is clear that improving action on the impact of globalization on infectious disease on an a priori basis is a highly cost-effective policy intervention. it is increasingly recognized that the long-term sustainability of globalization requires greater attention to the social, including the health, costs of current forms of globalization.